Good evening, sisters. I hope you're all doing good. Please, I think we have anatomy now. Like HAJIA said, someone should take us through fetal circulation. Hey, is it fetal circulation? Let me confirm. It's, okay, so fetal circulation and then the fetal skull. So please, can one person volunteer and then take us through? Hello? Please, can you hear me?
Yes, we can
Yes,
hear you.
we can hear you.
We can hear
Thank
you. Okay, thank you very much. So please, can we have one person to volunteer? Take us through fetal skull and then the fetal circulation.
Go back. Hey.
Sister Hussein, your hand is up. Hussein Aziz.
Good evening, sisters. Please, we'll be learning about the fetal skull. The fetal skull is the bone of the fetal head that covers the delicate fetal brain. It comprises of bones, sutures, and fontanelles. Development of the fetal skull. The bones of the fetal head originate from two different ways. The face is laid down in cartilage and is almost completely ossified at birth. That of the vaults are laid down in membranes and are much flatter and more pliable. In these, membranes are given points called ossification centers, and as pregnancy advances, calcium is laid around these centers, and so the skull bones begin to develop. Calcification takes place as the pregnancy advances and starts as early as 5 weeks of gestation.
Please, so Sister Hussein, it seems you are going fast. Please take your time somewhere. I beg.
The fetal skull comprises of bones, sutures, and fontanelles. Calcification of the fetal skull takes place at 5 weeks of gestation. Calcification takes place at the 5th week of gestation. The bones ossify from the centers outwards, and this process is incomplete at birth, leaving small gaps which forms the sutures and fontanelles. The incomplete ossification is important as it facilitates labor. The ossification centers on each bone appears as a bulge or protuberance. Division of the fetal skull. The fetal skull is divided into three, namely the vault, the face, and the base. The fetal skull is divided into three, namely the vault, V-A-U-L-T, the face, F-A-C-E, and the base, B-A-S-E. Talking about the vault. The vault is the large dome-shaped part above an imaginary line drawn between the orbital ridges and the nape of the neck. It is made up of bones, sutures, and fontanelles. The base. The bones of this area are incompressible and firmly united, which help to protect the brain. They occupy the inferior aspect of the fetal skull. The face. The face covers the area that extends from the orbital ridges to the junction of the mentum, that's the chin, and the neck. So the face extends from the mentum, the chin of the baby, to the neck, and it is made up of 14 bones. These bones are tightly fixed, that molding of facial bones is impossible. 14 bones are found in the fetal face, and they are tightly fixed, making molding impossible in the face. That is why face presentation is impossible in labor. So we are talking about bones of the vault. We said the vault is a large dome-shaped part above an imaginary line. That means you cannot see the line drawn between the orbital ridges and the nape of the neck. It is made up of bones, sutures, and fontanelles. So we are looking at bones of the vault. We have the
Hello,
occipital bone.
Sister,
Yes, please.
sister, please, is it in the slide?
I should go according to the slide.
No, me, I don't know where you are reading from. That's why I'm asking. I can't find it. That's why I'm asking. Continue.
This was from Margaret Mouse, but I'm looking at the
Please,
slide
we
now.
cannot find it in the woman's slide though. We can't find it.
There
So
is
please,
no,
if you know what it is, give
It's
us the
not in
page
the
there so
slide.
that we can.
it's not in the slide.
Sisters,
So
please, can we stop the slide thing? When Hajia comes,
I'm
she
not
doesn't
there
even
to
use the
see.
slides. So at least be jotting down some points,
How can
okay?
you say we should stop this slide? You people didn't tell us that it is not in the slide. We just started reading. So we just wanted to
Please,
find
no,
out
no,
if
no,
it
no,
is
Somebody
no,
in the
no.
just
Don't
Margaret
tell
Miles,
volunteered
me
then
to
I
we go
help
didn't
there.
us.
tell you
Why
that
are you
it's
angry at
not in the
somebody who
slides.
just
When Hajia is
volunteered to
teaching, do you
help
ask
us?
that question? And Hajia told us to do fetal skull and fetal circulation. That is what we are doing. The person is trying.
We are not saying somebody is not trying. No. All that we are asking is that we can't find it in the book. So if it is in the Margaret Miles that you
And
are saying, then
sisters,
just tell us. But don't
sisters,
say
we
should
believe
stop
that
reading
every class that we
slide,
have,
slide.
we have to finish before they give us the slide for the particular topic. So I think this is a new topic we are treating. Just that HAJIA is not in. So someone is taking us through before she comes. After the class, the slide will be given.
But must all the slides be given before they taught? They can talk before we can get the slides later on. So what is wrong with this? Please, sister, go
We are
ahead.
not saying, my friend, you cannot talk like that. If we cannot find, if we are using the Margaret Mark, just say that, oh, we don't have it, but we are using Margaret Mark. Is it wrong to ask? Or are you
Would
the
you
one
have
who pays
asked
somebody's school
HAJIA
fee?
for slides in
What
the
is
middle
it?
of a lecture? Would you have waited, or you would have asked HAJIA for a slide in the middle of the lecture? You know, at the end of the lecture, they will give us the slides. She just volunteered. Please, let's just allow her to help us.
We cannot just tell us where we are reading from, and so it has become a problem.
My sister, it's not about where she's taking the
We are
things.
not
Take notes, and then
slide is
later you.
composed, but we are saying that what she's reading, we thought it is in the slide. So if it is not there, we should
You
tell us
guys
that
are
it is
just
in the Margaret Mark, so that we go there.
You guys are making things so difficult. She's reading, she's teaching, so let's just pay attention. Whatever we want, later on you just go and refer and then read about it.
Please, the migrant mouse, what page what? Sister, please go ahead.
Moyɛ nhwehwɛ no mu paa mo moyɛ nhwehwɛ no mu nipa no kan ade no yɛhu baabi a ɔkan fi na yɛbisa ɛno nso yɛ wrong.
But you have to know where she's reading for before you learn. Somebody trying to help you.
Okay, just continue. There's no need you replying here. You guys should just continue.
Madam, no off.
So kasa papa. Hey.
Please,
Hey.
sisters, what you are doing with
just learned about respect. Please,
Oh,
please.
God.
Calm down.
Let's keep it quiet for her to continue.
Calm down. We just learned about respect.
We just learn respect and
Do you know that we are wasting our time?
You
know that some people are wasting our time on this platform. So we
mute everybody. Mute everybody.
Start recording there.
For saying you, please continue, okay? Sister, please continue for us. Thank you. Hello, Sister Bridget. Sister Bridget, you can talk.
Hello, please can you hear me?
Yes, please.
Hello. Please, I want to ask about the face. You said the face, it starts from where to where? The description, I didn't hear it from. I heard of the name to the chin, but I didn't hear the rest.
Please, what are you talking about? I can't hear you.
She was talking about the face. Please can you hear me? Hello?
Hello?
Hello? Yes, please. And she was talking about the face, the face. The face. And she said it starts from where to where? I heard of the name too.
They said the orbital region to the
Hello.
mention.
Okay. Okay. Thank you.
But now we have gone far away because of our problems.
Sister Hussein, please can you continue for us? So and then we beg. I don't even know her center. Hello, please can you hear me?
Yes, please, we can hear you.
Yes, we can hear you.
Yes, we can hear
Okay.
you.
Sister, please, the one who was taking us through, can you please come back? We beg, okay?
Sister, please, we are begging. Come back. Some of us were really enjoying it.
Stop
We
for
beg.
saying now. Please, stop for
We are
saying now,
begging. Just
please.
come back. Come back and continue for some of us.
The prayer stop that.
Sometimes some of those comments are not healthy at all. Somebody was just asking, is it in the slide? No, it's not there. I'm reading from this page. You people didn't even allow the one
Please,
who was
can we
sharing
stop
the
the
thing
argument
prior
again?
to
Please.
say I'm
Can
reading
we?
from here. Then you people are
Oh,
making
I
rules.
think
Let me volunteer and then read
What is
the
that?
Peter's cow.
Then you come and read for some of us. We are interested. What do you mean? Are you the only
I
one who paid?
some of us.
Please,
What
are
is
we
the
still
meaning of that?
going
Behave
over
like
this
adults,
again?
please.
Sisters, please, it's okay.
Let me
It's
read the
okay.
Peter's cow.
What is this?
Hey.
I think the person who was teaching has left the page. Oh, if anybody knows her, you should call her back.
She will leave it. Okay. What? Why will she leave?
Sister, you're a musician.
Please, can someone else take over?
Okay, if that's the case, I would like to take over, but I'm using the Sylvia Verals.
Okay,
Okay,
sister,
Sister
please,
Mabel.
I have a suggestion. Due to those who couldn't join on time when she started, I would like you to start so that they will catch up with us and we move together. In case HAJIA comes, then she continues. Thank you.
Okay, but she was using Margaret Mouse, so I don't know if the things are the same though.
So
Lizzie,
you
you
can
can
use
use what you
Classref.
have.
You can use
Classref.
or Margaret
Yes,
Mouse.
Classref. The
please.
lady has just texted on the page that she has been muted and she can't unmute. Hussein,
Please, I'm here.
Hey.
Okay.
Okay. Please continue.
Okay. So you're talking about the fetal skull. I'm starting all over, so please pay attention. The fetal head. So if you want to go according to Margaret Mouse is on page 118. Page 118 of Margaret Mouse. So the fetal skull. The fetal head is a large The fetal head is large in relation to the fetal body. And the fetal head is large in relation to the fetal body compared with the adult. Additionally, it is large in comparison with the maternal pelvis and is the largest part of the fetal body to be born. Adaptation between the skull and the pelvis is necessary to allow the head to pass through the pelvis during labor without complication. The bones of the vault are thin and pliable, and if subjected to great pressure, damage to the underlying delicate brain may occur. Important intracranial membranes, venous sinuses, and structure can be seen. We are going to divisions of the fetal skull. We have divisions and regions. So this is talking about the division. With the division, you have the vault, the base, and the face. The vault is the large dome-shaped part above an imaginary line drawn between the orbital ridges and the nape of the neck. The orbital ridge, that one is from your eyebrow to the nape of your neck. That's behind your neck. So that's the vault, the range of the vault from right above your eyebrow to the back of your neck. That's the vault. The base comprises bones that are firmly united to protect the vital centers in the medulla oblongata. The face is composed of 14 small bones that are also firmly united and non-compressible. These bones are tightly fixed that molding of facial bones is impossible, and that makes labor extremely difficult, if not possible, when the face is presented. So because the 14 bones of the face cannot be easily compressible, face presentation is impossible in labor. So we are moving forward to the bones of the vault. So we are picking the vault. We said the division of the fetal skull is the vault, the base, and the face. So now we are picking the vault, the bones of the vault. The bones of the vault are laid down in membranes. They harden from the center outwards in a process known as ossification. They said the bones of the vault, they harden from a process called ossification. Ossification is incomplete at birth, leaving small gaps between the bones known as sutures and fontanelles. So that means that the bones of the vault, they ossify, but then the sutures and the fontanelles do not ossify unless after birth. The classification ossification is incomplete at birth, leaving small gaps between the bones known as sutures and fontanelles. The ossification center on each bone appears as a protuberance. So with this protuberance, if during labor you use forceps to deliver the baby, or maybe vacuum, if there is too much pressure, the membranes can pass through that out. So we are moving forward to ossification of the skull is not complete until early adulthood. The bones of the vault. So we are looking at the bones of the vault. The occipital bone, which lies at the back of the head. So it's from the word occiput. So the occipital bone is part of it contributes to the base of the skull, as it contains the foramen magnum, which protects the spinal cord as it leaves the skull. The ossification center is the occipital protuberance. Then we have the two parietal bones, which lie on either side of the skull. The ossification center of each of these bones is called the parietal eminence. the two frontal bones, which form the forehead of or sinciput. The two frontal bones, which form the forehead or sinciput. The ossification center of each bone is the frontal eminence. The frontal bones fuse into a single bone by 8 years of age. The upper part of the temporal bone on both sides of the head form part of the vault. So with the vault, we are looking at the bones of the vault. We have the occipital bone, the parietal bone, and the frontal bone. With the bones of the vault, we have occipital bone, parietal bone, frontal bone, and the upper part of the temporal bone. We are moving on to sutures and fontanelles. The sutures are the cranial joints formed where two bones meet. So where two bones meet, there is a suture. Where two or more sutures meet, a fontanelle is formed. Two bones, the joint with which two bones meet is a suture. Two or more is a fontanelle. The sutures and fontanelles described below permit a degree of overlapping of the skull bones during labor, which is known as molding. So molding is termed as the overlapping of the skull bones during labor. So we are talking about the lambdoidal suture. The lambdoidal suture separates the occipital bone from the two parietal bones. The lambdoidal suture separates the occipital bone, and we know the occipital bone is at the occiput of the fetal skull. So the lambdoidal suture separates the occipital bone from the two parietal bones. The sagittal suture, it lies between the two parietal bones. So if you look at the diagram in the mouse, you will see that there are two parietal bones, one parietal bone at each side. And they are saying in between the parietal bone, the suture lying there is known as the sagittal suture. And extending backwards, the sagittal suture goes to meet the lambdoidal suture that's going to the occiput. So we are moving on to the coronal suture. It separates the frontal bone from the parietal bones. The coronal suture separates the frontal bones from the parietal bones, and this can be seen from right above the ear. Hello. From right above the ear, one ear to the other. That's how to easily identify the coronal suture. It separates the frontal bones from the parietal bones, passing from one temple to the other. The frontal suture runs between the two halves of the frontal bone, whereas the frontal suture becomes obliterated in time, the other sutures eventually become fixed joints. The posterior fontanelle or lambda, shaped like the lambdoidal and sagittal suture. So you're talking about the one at the back. It is small, triangular in shape, and can be recognized vaginally because a suture leads from each of the three angles. It normally closes by 6 weeks of age. So on vaginal examination, they said it can be felt. That's the lambdoidal suture. It can be felt during VE, and it closes at 6 weeks of age. So when the baby is out, 6 weeks, after 6 weeks, that suture closes. The anterior fontanelle, and we all know anterior is front and posterior is back. So they said the anterior fontanelle or bregma is found at the junction of the sagittal, coronal, and frontal sutures. The sagittal, coronal, and frontal form the anterior fontanelle, also called the bregma. And the posterior fontanelle, which is called the lambda, is at the junction of the lambdoidal and sagittal sutures. Okay. And we are saying the posterior one closes at 6 weeks of age.
Hello, please, can you repeat what you just said again?
Which one? Is it the posterior or the anterior?
The anterior. The anterior. Thank
You're
you.
saying that the anterior, which is also called the bregma, is found at the junction of the sagittal, coronal, and frontal sutures. So 3 sutures form the bregma, which is the anterior fontanelle. 3 sutures form that one. But the posterior 2 sutures form the posterior, and 3 form the anterior. Okay, so I'm continuing. And
thank you.
Yes, and they are saying that during labor, when you perform VE, is the posterior fontanelle that you touch. Okay, so you're moving. So the anterior fontanelle or bregma is found. Okay, is found at the junction of the sagittal, coronal, and frontal sutures. It is broad, kite-shaped. So the anterior is kite-shaped, and then the posterior is triangular in shape. Okay. And recognized vaginally because a suture leaves from each of the 4 canals. It measures 3 to 4 centimeters long. So that's the measurement of the anterior sutures. Sorry. The anterior fontanelle, that's the bregma, measures 3 to 4 centimeters long. That's the length, 3 to 4 centimeters. 1.2 to 2 centimeters wide, that's the width. 1.5 to 2 centimeters wide, and normally closes by 18 months of age. So the posterior closes at 6 weeks, and the anterior closes at 18 months of age. Pulsation of cerebral vessels can be felt through this fontanelle. So when the baby is born, you notice that place, it goes up and down. That's what they are talking about, the pulsation of cerebral vessels. So it's also that part that we can detect if the baby is dehydrated or not due to the pulsation. So we'll finish with the divisions. We are now going to regions and landmarks of the fetal skull. The skull
Please,
is...
a question. Please, a question. Please, how long does the frontal suture closes?
18 months.
18. Okay, thank you.
18 months. And then the posterior is 6 weeks. So regions and landmarks of the fetal skull. The skull is further separated into regions. So we look at divisions, and the division, we have the vault, the face, and the base. And now they are saying that the fetal skull is divided into regions too. So the skull is further separated into regions, and within these, there are important landmarks. These landmarks are useful to the midwife when undertaking a vaginal examination, as they help ascertain the position of the fetal head. The occiput region. So let me just go through. With the regions, we have the occiput, the vertex, and we have the sinciput. So the sinciput is the forehead, the vertex is the middle, and then the occiput is at the back. So those are the regions. Please do not confuse the divisions and the regions. With the division, you have the vault, the base, and the face. With the regions, you have the occiput, the vertex, and the sinciput. Okay. Yes, please.
So meaning we have 3 regions.
Yes, and we have 3 divisions too.
Okay, thank you.
Welcome. So the occiput, we are picking the occiput. That's part of the region of the fetal skull. The occiput lies between the foramen magnum and the posterior fontanelle. The occiput, it lies between the foramen magnum and the posterior fontanelle. And we said the posterior fontanelle is also called the lambda, and it is triangular in shape. The part below the occipital protuberance is known as the suboccipital region. The part below, you know, something that is under something is called a sub. So they said that the part below the occipital protuberance is known as suboccipital region. Okay, so we are moving on from the occiput. We are going to the vertex, regions of the fetal scalp. So the vertex region is bounded by the posterior fontanelle, the two parietal eminences, and the anterior fontanelle. I'm taking it again. The vertex is bounded by the posterior fontanelle. The posterior, that's the lambda, and the two parietal eminences, and the anterior fontanelle. So we can say that the vertex is in between the two fontanelles. Okay. The forehead or sinciput. The forehead or sinciput region extends from the anterior fontanelle and the coronal suture to the orbital ridges. And we explained that the orbital ridge is right above your eyebrow, the bone there. So they are saying the forehead or sinciput extends from the anterior fontanelle. And we learned that the anterior fontanelle is called the bregma. So the forehead extends from the bregma to, and the coronal suture, which runs into the bregma, to the orbital ridge. So simply, that's the forehead. Okay. So the face extends from the orbital ridges and the root of the nose to the junction of the chin or mentum and the neck. The point between the eyebrow is known as the glabella. The point between the eyebrows is known as the glabella. So the point between your eyebrows, that's the part extended down to your nose, is known as the glabella. So we are looking at the diameters of the fetal skull. Knowledge of the diameters of the skull alongside the diameters of the pelvis allows the midwife to determine the relationship between the fetal head and mother's pelvis. So diameters of the fetal skull. There are 6 longitudinal diameters. Please, there are 6 longitudinal. We are picking the longitudinal. The longitudinal section is ranging from the forehead to the occiput, from the front to the back. That's the longitudinal. And they are saying that there are 6 longitudinal diameters. So we are picking each one. So the suboccipitobregmatic, short form SOB, suboccipitobregmatic diameter. So we are measuring that one. So the suboccipitobregmatic diameter, it is 9.5 centimeters. Suboccipitobregmatic, SOB, short form, it measures 9.5 centimeters. And it is measured from below the occipital protuberance to the center of the anterior fontanelle or bregma. The suboccipitobregmatic is always from the name. So suboccipitobregmatic, that means it's from the occipital protuberance to the bregma. And then we know the bregma is the anterior fontanelle. So suboccipitobregmatic is from the occipital protuberance to the center of the anterior fontanelle, which is also called the bregma. And it measures 9.5. We are moving on to the second longitude. So that one is the suboccipitofrontal. Suboccipitofrontal. So that one is still from the occipital protuberance, but you are extending further because it's the frontal. That one measures 10 centimeters. Suboccipitofrontal, SOF, short form, SOF. It measures from below the occipital protuberance to the center of the frontal suture. To the center of the frontal suture. And we know the frontal suture is in front of the bregma. So that is why its measurement is more than the suboccipitobregmatic. So we are moving to the third one, the occipitofrontal diameter. Occipitofrontal diameter, that means ranging from the occiput of the fetal skull to the frontal suture. So the occipitofrontal, OF, measures 11.5. It measures 11.5. So this occipitofrontal diameter measures from the occipital protuberance to the glabella. From the occipital protuberance to the glabella. And we learned that the glabella is the point between the eyebrows. The point between the eyebrows is the glabella. And the occipitofrontal diameter, which is 11.5, measures from the occipital protuberance to the glabella. Okay, so we are moving on to the fourth one, which is the mentovertical, MV short, mentovertical. Mento from the word mento to the vertical, vertex. Hello. So the mentovertical diameter, it measures 11.5 centimeters. 11.5. Mento means mentum, which is also the chin. So the mento.
Please check the diameter again. Did you say 11.5?
Which one?
13.
It's 13.
13.
13.
Please, I'm yet coming. I said the mentovertical. From
Yeah, you said the
occipitofrontal.
diameter is 11.5, but it's
No, please. Occipitofrontal is 11.5. Mentovertical is 13.5. I'm yet coming.
13.5.
13.5.
Yes, please, 13.
Yes, occipitofrontal is 11.5. The mentovertical, which is where I am now, is 13.5. And it is measured from the point of the chin or the mentum to the highest point of the vertex. So mentovertical, mentum to the vertex. And they are saying the highest point of the vertex. Okay. So the submentovertical, which can be shortened to SMV. Submento. And I said sub is like something within a region. So the submentovertical, which measures 11.5. Mentovertical is 13.5. Submentovertical is 11.5. And it's measured from the point where the chin joins the neck. The point where the chin joins the neck to the highest point of the vertex. So with the mentovertical, it's right on the chin. But the submentovertical, you move downwards where the chin joins the neck. And that one measures 11.5. Okay. So we are moving on to the seat one. The submentobregmatic, SMB short form, submentobregmatic. And this measures 9.5 centimeters. Submentobregmatic, SMB, 9.5 centimeters. It measures from the point where the chin joins the neck to the center of the bregma. And we know the bregma is the anterior fontanelle. So it measures from the point where the chin joins the neck to the center of the bregma. Okay. So I'm taking them again. Suboccipitobregmatic measures 9.5. Suboccipitofrontal 10.0. Occipitofrontal 11.5. Mentovertical 13.5. Submentovertical 11.5. Submentobregmatic 9.5. So we are done.
Please, a question.
Yes, please.
As you are reading, I'm using my head to get this to measure, but I don't understand why mental vertical is higher than submental vertical, because the submental vertical is almost getting to the neck. So when you measure from the neck to the vertex,
You feel it should be
higher.
longer.
Yeah, it's
So
longer than the mental. The mental is just the thing to the vertex. So that one should the submental should rather be longer than the mental. And when you come to, or should you explain before I
let me
move on?
explain that. So
Okay.
with your measurement, you are not measuring from like through your face. You are rather supposed to measure it from your neck to the ear side, like sideways, not through your face. Are you getting what I'm saying? Don't pass the measurement from under your neck. Let it pass your nose and then your forehead, and you measure it up. No, you are measuring it sideways. You see, that way it's shorter than if you want to pass it through your face.
Okay.
Are you getting me?
Yeah.
So you measure
So
it
does that apply?
sideways.
Okay. Okay. Thank you. So does that apply to the subocipitobregmatic? Because we know subocipitobregmatic to be the frontal, right?
Yes.
Is it? So
So
that
we
one
are
too is
all
from
sideways. Yes.
So that one too is from under the occiput to the vectors, right?
Yes.
And the subocipitofrontal, that one is under the occiput to the frontal too. So I don't really get it.
So with that
Because
one,
I know
you don't.
bregmatic to be frontal.
So what I'm saying is the measurement, don't look at it like you are passing it over the head, but let's rather look at it like the skull is lying on the side. So you are looking at one ear. So you are taking the measurement that way. Are you getting me, please? Look at it.
The same thing.
It's not the same. Look at it like the skull is on one side. That means that one ear is to the other side, and then the other ear is facing you. So that is how you are measuring it. You are measuring it
So
from.
when you measure it that way, won't you? So okay, I get you. Okay, thank you.
You get me. You are measuring it from sideways, and it's not extending through the face. That way it's going to be longer, and you get different measurements. Okay. So we looked at the longitude now, which are 6, and they are saying that we have the transverse. So with the measurement, we have the transverse diameters and then the longitudinal diameters. So the longitudinal are the suboccipitobregmatic, suboccipitofrontal, the occipitofrontal, mentovertical, submentovertical, and submentobregmatic. But with the transverse diameters, we have only 2. With the transverse, we have only 2. The bitemporal diameters and then the biparietal diameter. So we are picking the biparietal diameter. And this measures 9.5 centimeters, the diameter between the 2 parietal eminences. So bi means 2. So with this one, you are going from one parietal bone to the other. and it measures 9.5 centimeters. Then we go to the bitemporal diameter. The diameter between the two farthest points of the coronal suture at the temples. So more like almost your ear, the top of your ear to the other side. And they are saying that in the baby, the fetal scar, it measures 8.2. So with the transverse diameters, we have two: biparietal, bitemporal. Biparietal is 9.5, bitemporal is 8.2. Longitudinal sutures are 6. Transverse longitudinal diameters are 6. Transverse diameters are 2, making them
Sister
8
Dinah, you are
diameters
disturbing us.
in all.
Oh, sorry.
So presenting diameters. Some presenting diameters are more favorable than others for easy passage through the maternal pelvis. And this will depend on the attitude of the fetal head. The term attitude is used to describe the degree of flexion or extension of the fetal head on the neck. The term attitude is used to describe the degree of flexion or extension of the fetal head on the neck. The attitude of the head determines which diameters will present in labor and therefore influences the outcome. The presenting diameters of the head are those that are at right angle to the curve of Carius. The presenting diameters of the head are those that are at right angles to the curve of Carius of the maternal pelvis. There are always two, the longitudinal and the transverse. The presenting diameters determine the presentation of the fetal head. The presenting diameters determine the presentation of the fetal head, for which there are 3. So they said the presenting diameters are 3. We have the vertex presentation, the face presentation, and then the brow presentation. So this applies only in cephalic presentation. If the baby is coming cephalic, then you further go down to assess, is it vertex presentation, face presentation, or brow presentation? So we are picking the vertex presentation. When the head is well flexed, the suboccipitobregmatic diameter, and we said that one measures 9.5. So when the head is well flexed, the suboccipitobregmatic diameter, which measures 9.5, and the biparietal diameter, which measures 9.52. So suboccipitobregmatic and biparietal diameter, both of them, they have the same measurement, 9.5. They present, that's in the vertex presentation. As these two diameters are the same length, the presenting area is circular, which is the most favorable shape for dilating the cervix. So the most favorable shape for dilating the cervix. And back of the head, the diameter that distends the vaginal orifice is the suboccipitofrontal diameter. The diameter that distends the vaginal orifice is the suboccipitofrontal diameter. So the one that opens up the cervix is the suboccipitobregmatic and the biparietal. And with the vaginal orifice is the suboccipitofrontal. Hope you get the difference. For the cervix is the suboccipitobregmatic and the biparietal diameters. And with the vaginal orifice is the suboccipitofrontal. When the head is deflexed, the presenting diameters are the occipitofrontal, which is 11.5. When the head is deflexed, the presenting diameters are the occipitofrontal and the biparietal. So they can ask you a question. When the head is flexed, which diameters present? And you know that one is the suboccipitobregmatic and the biparietal. But if it is deflexed, that means it's the occipitofrontal and the biparietal. And the occipitofrontal is 11.5. But the suboccipitobregmatic is also 9.5, like the biparietal diameter. Okay. So the face presentation. When the head is completely extended, the presenting diameters are the submentobregmatic. When the head is completely extended, the presenting diameters are the suboccipitobregmatic, which is 9.5, and the bitemporal, which is 8.2, is part of the transverse diameter, which is 8.2. The submentovertical diameter, which is 11.5, will distend the vaginal orifice. So with this, the space would seem tighter or smaller for it to pass. That's with the face presentation, because the presenting diameters are the submentobregmatic, which is 9.5, and the bitemporal, which is 8.2, and the submentovertical, which is 11.5. Brow presentation. When the head is partially extended, so this one, it's more like the fetus has raised the head. They'll say that the fetus wants to see what is already outside. So when the head is partially extended, the mentovertical diameter, which is 11.5, the mentovertical diameter, which is 13.5, that's the longest diameter. When the head is partially extended, the mentovertical diameter, that's from the mentum to the highest point of the vertex, which is 13.5, and the bitemporal, which is 8.2, present. If this presentation persists, vaginal birth is unlikely. So we have three presentations: the vertex, face, brow. Vertex is the most suitable. Face presentation, not suitable, but you can just put your hand and push the chin down with that one during VE for it to come as vertex. But with the brow, please, theater, there is nothing to be done about that one. So moving forward, we are going to talk about molding. Molding. The term molding is used to describe the change in shape of the fetal head that takes place during its passage through the birth canal. The change in shape of the fetal head that takes place during its passage through the birth canal. Change in shape of the fetal head that takes place during its passage through the birth canal. Alteration in shape is possible because the bones of the vault allow a slight degree of bending, and the skull bones are able to override at the sutures. Alteration in shape is possible because the bones of the vault allow a slight degree of bending, and the skull bones are able to override at the sutures. This overriding allows a considerable reduction in the size of the presenting diameters, while the diameter at right angles to them is able to lengthen owing to the give of the skull bones. The shortening of the fetal head diameters may be by as much as 1.25. So if you're talking about, let's say, the suboccipitobregmatic, which is 9.5, they said it can reduce by 1.25. So you subtract 1.25 from it. That's how come it reduces. That's during molding, for the hair to be able to pass through the cervix and through the vaginal orifice. Okay. The dotted, okay. Additionally, molding is a protective mechanism and prevents the fetal brain from being compressed as long as it is not excessive. Additionally, molding is a protective mechanism and prevents the fetal brain from being compressed as long as it is not excessive, too rapid, or in an unfavorable direction. The skull of the preterm infant is softer and has wider sutures than that of the term baby. I'm taking it again. The skull of the preterm infant is softer and has wider sutures than that of the term babies. So it is softer and has wider sutures than that of the term baby, and hence may mold excessively. Should labor occur prior to term. Venous sinus.
Auntie Rose, you are this.
Venous
Both
sinus.
you are disturbing. Rose, both you are disturbing.
Hey, Obaya Mami.
Venous sinuses are closely associated with intracranial membranes, and if membranes are torn due to excessive molding or precipitate labor, there is danger of bleeding. A tear of the tentorium cerebelli may result in bleeding from the great cerebral vein. A tear of the tentorium cerebelli may result in bleeding from the great cerebral vein. So in conclusion, we are concluding the fetal skull. Embryonic and fetal development occurs alongside placental development. There is constant growth and remodeling of cells, tissues, organs, and systems prior to birth. Several temporal structures in the fetus support systems in utero. These consequently become redundant at birth, and they either disappear or become ligaments. At birth, all organs are functioning, but some may be immature and continue to develop as part of extrauterine life. So that is it for fetal skull. Any question, please? If not, we'll go to fetal circulation.
Hello, sister.
Yes, please.
Please, the presentation and the brow presentation. Please go on that one for me. That's all. Please.
Face presentation.
Yes.
Face presentation. When the head is completely extended, the presenting diameters, so we are talking about the diameters, which make it face presentation. So it is the submentobregmatic, and we said sub is part of a region. So right under the mento, that's the chin. So submentobregmatic. So from under the chin to the bregma, under the chin to the bregma. And we said the bregma is the suture that is formed from the frontal suture, the coronal suture, and the sagittal suture. And it has a kite shape or a diamond shape. So you are saying that the face presentation, it extends from the submentobregmatic, which is 9.5, and the bitemporal, that's the transverse diameters, which is 8.2. So the submentobregmatic and then the bitemporal. So the submentovertical diameter, which is 11.5, distends the vaginal orifice. Please, did you get me?
Yes, sister.
So when you're talking about the presentation, we always talk about the sutures that influence the cervix, and the one that would also, I'm talking about the diameters that would influence the dilatation of the cervix, and then the one that would also pass through the vaginal orifice. And with the first presentation, they are saying that the submentobregmatic and the bitemporal, so they are those that will pass through the cervix. And the one that would distend the vaginal orifice for the fetal head to be born is the submentovertical, and that one is 11.5. So I'm going to the brow presentation. When the head is partially extended, the mentovertical diameter, which is 13.5, the mentovertical diameter 13.5, and the bitemporal diameter 8.2. That's the measurement. The mentovertical diameter and the bitemporal, they pass through the cervix. And if this presentation persists, vaginal birth is unlikely. And I was explaining that the most ideal presentation is the vertex. And even with the vertex, it has a flexed and deflexed. That's the two types. With the vertex, it has flexed and deflexed. With the face presentation, during vaginal examination or if the head escapes the cervix, you can put your hand and slightly press on the chin so that the vertex is rather engaged, so that you rather change the face presentation to a vertex presentation. But with the brow presentation, they said the head is partially extended. So with this one, it's more like the baby has raised the head. So it's from the brow to the chin that is going to sweep the vaginal orifice. And they are saying that this process is very, very unlikely. So if you detect that on vaginal examination, if you detect that you are touching the nose or the chin of the baby, please prepare the client for theater. Thank you. Any question? Any question, please?
Yes, please. I have raised my hand, but it's like you're not seeing me.
Oh, okay.
Please, I want to ask, with the fontanelles,
Yes.
the anterior fontanelle, we had the measurements for it, but it seems we didn't get for the posterior fontanelle. Please, did you get my question?
Yeah. Yes, I got your question.
Okay. So please, can we get the measurements for the posterior fontanelles?
Well, unless I also search about that, but what I was taught in class is that it measures 1 to 2 centimeters. That was what my madam told me back in school.
Okay, is it with the length or with the width, the 1.2?
That's the length.
Okay.
But then I think you have to search and see, because in the Margaret Mouse, it's only the frontal they gave the measurement for. That's the anterior, but the posterior they did not give the measurement for it.
Okay.
So
Thank
maybe you can search for that one too.
Thank you.
Yes.
Oh, Mother Cynthia, you are disturbing us. Abba, mute yourself.
Please mute yourself. Why? Hi.
So are we okay with that, please? Are we okay, or I should just go through like with a summary? Should I summarize everything?
Yes, so please.
Yes,
Summarize.
please. Okay, so we started with the fetal skull, and we went further to talk about divisions of the fetal skull. So divisions of the fetal skull, we have the vault, the face, and the base. Division of the fetal skull, we have the vault, the face, and then the base. Then we move forward to the bones of the vault. That's one of the division. That's the vault. Bones of the vault. We have occipital bone, the two parietal bones, and the frontal bone. And they also said upper part of the temporal bone. So actually there are four. The occipital bone, bones of the vault, occipital bone, two parietal bone, frontal bone, and upper part of the temporal bone. Then we have sutures and fontanelles. Sutures and fontanelles. And it was explained that the sutures are the cranial joints formed where two bones meet. So the formation of two bones is the suture. And two or three. So let me just say three. Three is a fontanelle and two is a suture. Where two bones meet is a suture that you name there. And where three or four will meet is a fontanelle. Okay. So we have the lambdoidal suture. So two sutures are meeting to form the lambdoidal suture. And this is extending from the occipital bone to the two parietal bones. That's the lambdoidal suture. And it is triangular in shape. Triangular in shape. So we have the lambdoidal suture. There are two types of sutures. Two types of fontanelles, the lambda and the bregma. The bregma is the anterior and the lambda is the posterior. The bregma is the anterior and the lambda is the posterior. And we're saying that the posterior one, it closes at 6 weeks. After birth, at 6 weeks. The triangular shaped one, 6 weeks. And the anterior, which is the bregma, closes at 18 months. At 18 months. And I explained that when the baby is born, it is at this place you see pulsation. You see that place is like when the baby is breathing, it will be going up and down. Okay. So we are moving on. Then we talk about the regions and landmarks of the fetal skull. Divisions are 3 and the regions too are 3. So please do not confuse yourself. Divisions are 3, regions too are 3. Division is the face, the vault, and the base. Face, vault, base. Regions, we have the occiput, the occiput, the vertex, and the sinciput. Occiput, vertex, sinciput. And another name for the sinciput is the forehead. So simply the forehead, the vertex, and the occiput. Those are the regions of the fetal skull. Then it went on further to say that there are diameters of the fetal skull, and we have two types, the longitudinal diameters and then the transverse diameters. The longitudinal consists of 6 and transverse 2. So we are picking the longitudinal. With the longitudinal, we have the suboccipitobregmatic, which is 9.5, suboccipitofrontal, which is 10, occipitofrontal, which is 11.5, mentovertical, which is 13.5, submentovertical 11.5, submentobregmatic 9.5. So those are the 6. of the longitudinal diameter, and we have the two transverse. These are only two of the transverse. We have the biparietal diameter, which is 9.5, the bitemporal diameter, which is 8.2, biparietal 9.5, bitemporal 8.2. And then we went further to learn about the presenting diameters. Presenting diameters. And we said the presenting diameters, there are also three. So with that, we are learning about the presentation. The presentation. And with the presentation, we learned about attitude. And we said attitude is used to describe the degree of flexion or extension. The degree of flexion or extension of the fetal head on the neck. So if the head turns 90 degrees, 45 degrees, 15 degrees, that is the attitude. So with the presentation, we have the vertex. There are also three: vertex, face, and brow. Presentation, we have the vertex, the face, and the brow. And with the vertex, we said the vertex is the most suitable presentation, and it has two types. It has the flexed vertex presentation and the deflexed vertex presentation. Flexed vertex presentation and the deflexed vertex presentation. So let me just talk about with the flexed, the suboccipitobregmatic diameter, which is 9.5, and the biparietal diameter, which is also 9.5. So the two, they measure the same, suboccipitobregmatic, and then the biparietal, which are both 9.5, are those that come when the vertex is flexed. When the vertex is flexed, we have suboccipitobregmatic and the biparietal. When it is deflexed, we have the occipitofrontal and the biparietal. So the biparietal is constant in the vertex presentation, but in a flexed one, it's suboccipitobregmatic, deflexed occipitofrontal. In a flexed, suboccipitobregmatic, which is 9.5, deflexed occipitofrontal, which is 11.5. Okay. So we have the face presentation, which is the second one. And this is when the head is completely extended and the presenting diameters are the submentobregmatic and the bitemporal. Submentobregmatic, which is 9.5, and the bitemporal, which is 8.2. 8.2. Okay. Then we have the brow presentation. This is where the head is partially extended. Brow presentation. The head is partially extended. Yes, please.
My dear, please, I'm sorry to interrupt you.
Yeah.
But I really want to understand what you are showing us. So please, if the person who is helping us with the screen, if the person can show us where the parental measurement, the 9.5, and like you use your mouth and describe it, it's from here to this place, so that the understanding will be clear. I don't know if I'm the only one who is not understanding. I'm begging.
So with the measurement, this one being shown here, if you want to measure, you get the measurement wrong. So look at the measurements. The third diagram, that one is the easiest. So somebody was asking, why is that from the chin to the middle of the head is shorter than from, no, why is that from below the chin to the middle of the head is shorter than from the chin to the middle of the head? So can you see how I was describing how the head should be placed? So this is the measurement. You are measuring from the side and not all over the face. From the chin, we want to pass the nose, pass the forehead, and come to the middle of the vertex. That's not how you measure. You measure sideways. So these are the measurements. Please, have you seen what I'm talking about? Hello?
Yes, please.
Yes.
So this is how you measure it. If you want to measure how maybe around, that one is when the baby is out, we usually take the sub-occipital bregmatic measurement, and that one then you check and you get the 33 meters. So that one, if you want to measure that way around, you be getting, that's where you come and they'll say head circumference. Then you say 33 centimeters and that. But if you are measuring the fetal skull from one point to the other, you measure sideways and not around. Please, are we together?
Yes.
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 Hello.
So the only one that you measure directly is the transverse diameters. That one you measure from one point to the other. That one is easier. That one you measure it on the head. But when you're talking about the longitudinal, it says longi. So it's from one point to the other, but it's from the sideways. It's not on top. But it's the transverse diameter that you are aiming at the top of the fetal head. But with the longitudinal, you measure it from the sideways. More like you are looking at one face of the baby and you are measuring it that way.
Okay, so that means the longitudinal is like diagonal, the measurement.
Yes.
Yes.
And the transverse is more like you are looking at the baby, the top of the head, and you are measuring. Okay.
Hello, Sister Husseini.
Yes.
Please, with the regions of the fetal skull, you
Yes,
said there
please.
are 3.
Yes.
But which means the face is not part of the regions. Because in the Margaret mouse,
yes,
after the sinciput, then
Can
there's
you
the
can you
face.
please mention the regions of the fetal skull?
The regions of the fetal skull
Yes.
is the occiput region, the
Yes.
vertex region.
Yes.
Then after the forehead and the sinciput, there's
Mhm.
the face. So which means the face is not part of it or it's part.
It's not part. They were just describing that the face extends from the orbital ridges in the root of the nose to the junction. So they are trying to explain the glabella. If you look down,
yes,
they are describing the glabella. So they want you to get a vivid picture of it. That is why they said the face.
Okay, so the glabella is not part.
It's
of
not
the
part. So when we started, we're talking about the orbital ridge.
Yes.
The orbital ridge.
Yes.
So the glabella, the beginning of the glabella is the orbital ridge. Just the beginning, that's in between your two eyes. What will extend down to be your nose is the whole glabella. But from the beginning is the orbital ridge.
Okay.
Okay, yes. Yes, please. So from all that, from the presentations, that's the vertex, the face, and then the brow, we move to molding. And so molding is used to describe the change in shape of the fetal head that takes place during its passage through the birth canal. And we said during molding, each of the measurements we took, it reduces by 1.25. So if you are picking any of them randomly, you are picking sub-occipital bregmatic, which is 9.5. You are going to subtract 1.25 from it to get the actual length or the actual measurement that takes place during molding. And then they went further to say that in preterms, the skull is softer and has wider sutures than that of the term baby. and hence molding will be excessive. Molding will be excessive. So there's excessive molding in preterms because the skull is softer and then the sutures are wider. So that is all.
Hello.
Yes,
And
please.
please, the one you are projecting, please, can you project the regions? The one projecting. The regions. Because they added the face to the regions. Because the one the person is projecting, it has for the occiput region, the vertex, the sinciput, then the face, which means the face is not part of it all. That's what I want to know.
Okay, so the thing is, in Margaret Mouse, there are 3 faces, 3 regions. But when I was in school, I was taught 4.
Yeah.
The 4th one is the face.
The
And
face.
even with the face, it also has the landmarks.
Yes.
So for me, I know that there are 4 for the
Yes.
regions. And
Yes.
the face is the 4th one. And then it was even said the face is the smallest of the regions.
Yeah.
So that's what me I know.
Yes.
But because we were confused at the beginning, I didn't want to go with my notes, and I went with the Margaret Mouse.
And
because
because
it says from Madame's slice is also 4. So let's go with the
4.
Yes.
So
please.
which means the regions are 4 and the
Yes.
divisions are 3.
3.
Thank you.
Welcome. Thank you too.
So please, what adds to the regions making a 4? Because you initially mentioned it.
The face. Face.
Face. Oh, okay.
Yes. So it's occiput, vertex, sinciput, then the face. Occiput, vertex, sinciput or forehead, then the face. So I would have continued with the fetal circulation, but yes. Maybe someone would take over from that. Are there any more questions?
Hello.
God bless you. God bless you.
Which means that the divisions too has 3, which is the face,
the vault, and the base.
The vault and the base. And the other one too has face in it, right?
Yes, the other one too has face.
Okay. Thank you.
So please, who is taking us through fetal circulation?
It's almost done.
I thought the closing time is 7:15. So we have like 30 more minutes or 29 minutes.
Oh, sister, in fact, you've done well. Thank you and God bless you.
For us, please.
Welcome.
Sister Fuseni, God bless you so much, okay? God bless you for us. Please, my name is Esther. I will sit beside you, okay? End of same.
Hey!
Sisters, please, I want to correct this. There's nothing like Sister Fuseni. Fuseni is her surname, please. So you can't say Sister Fuseni. Thank you.
Please, what can I say?
Sister Hussein.
But NTC, we were taught say
Yeah,
sister
we are just by surname.
one on the surface.
We are just by surname.
No, listen. The Fuseni is more like her father's name. So if we say Sister Fuseni.
Please, that's her surname. In nursing, we are addressed by surname.
This one to another debate. We are looking for someone to take us through.
right. We are dressed with the surname. So if I can't say Sister Husseini, then what can I say?
A man's name goes with sister.
That's what I'm trying to, but it's okay. Well,
Black Rasta. They won't do. Oh, Larma, we are banning room, but
Hello, stop. Hello. Hello. Hello.
Black Rasta, the buy on Kutura.
Hello, sisters, please, can you hear me?
Yes, we can hear you.
Yeah, we can hear you.
Yes, we can hear
Stop
you.
Husseini, thank you very much for today. We are grateful. Please, should we continue with the Obiano Yeden, Papa? Please, should we continue with the fetal circulation or we should?
It's almost time.
We should. Yes, it's almost time.
Fetal
But
circulation
I don't want
is a
the
lot.
fact that someone will say we're about to do it and Koshef says that. So I want us all to come into an agreement so that no one's name will be mentioned. It will be a decision from the whole class. That is why I'm asking. Should we continue or we should call it a day?
With a
We should
fetal
call it a
circulation,
day.
it's a lot. If we start, we won't finish.
Yes, it's
It's
a
a
lot.
lot.
So let's
Yeah.
call it a day.
So let's do it some other time.
Okay. Thank you all very much,
Thank
especially
you
Staff
too.
Training. God bless you. So let's call it a day. Thank you all and have a good night.
Good night. Same to you. We're grateful. Please get me my this one.